What are the chances of actually succeeding non-operative management? It's actually up to 90%. But then, do they need the appendix to be removed subsequently? Well, there's going to be risk factors that you have to consider for removal of the appendix in the future. One is going to be age, above 40, and number two, the presence of fecalith, which actually increases your risk of recurrence. However, you have to understand the baseline with the risk of recurrence on what it is. It varies. It can vary from 5 to 15%, and some reports have actually mentioned 15 to 40% in a year. So the patients have to understand and know that one. However, for the people above 40, you have to consider removing their appendix because there is a 1% risk of malignancy that is actually noted and described in papers. For people above 40 who will get an internal appendectomy, they should also undergo a colonoscopy prior to surgery. This will screen for anything that can actually cause appendicitis that may be a luminal obstruction secondary to tumor. This changes the type of surgery that we will be performing in that instance.